What's going on, everyone? Happy Thursday. Hopefully, everyone is doing well, staying safe, healthy, and testing negative for all those viruses that can make us sick. It is time now for the Thursday edition of the Virus Update for Thursday, October 23rd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, but not enough information is going around to keep you informed of what's going on with these viruses. That's what I do here on my channel each and every day with the latest news, data, wastewater, and anything else I can find to help keep you safe and informed. If you want to stay informed, just subscribe to my channel down below, especially if you're new. If you like today's video, give it a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Already, we do have some news to take a look at today, including the weekly report from New South Wales and some other news to take a look at. Not sure if we're going to get into UK or not. That may not be in yet. We're recording rather early today. We're going to look at some daily data, and we are also going to take a look at a dashboard we have not looked at in a long time. Someone made a mention about it the other day, and I thought, well, you know what? Might as well show it. I can't show what they want. They want COVID variant data. Unfortunately, some states just don't do it. Yeah, it's a sad state of the times that we're in. Also, we got some data from CJS. So let's get started, shall we? New South Wales from Dentist COVID Info Guide. Respiratory Surveillance Report for week ending October 18th, 2025. The COVID positivity rate is 2.4%. Hey, that's down by 0.2%. Number of laboratories reporting COVID, 3 out of 4. COVID, 648 cases, that's down by 3.1%. Influenza, 2,219 cases, down by 3.2%. RSV, 493 cases, down by 2.4%. Now, in this case, we can take a look at the latest COVID variant data for New South Wales in Australia, and we do now see that PE.1.4 is now 40% of the cases up to October 11th. That's interesting. NB.1.8.1 is now at 35%, XFG 20%, and others would be 5%. So PE1.4. I don't know if that's going to become the next big thing worldwide, but in that particular area, it is doing well at this time. It also looks like 3 out of the 4 wastewater areas are trending upward at this time. Could that be because of PE.1.4 now being at 40%? It is possible, so that's something we'll have to continue to watch. Moving on now to this from Sci-Fi. Updated SARS-CoV-2 positivity rates for weeks ending October 12th. This is for, what is this, 15.5, and I think 95 countries, and then 15.5% for 98 countries, and then 7.5% for 19 countries. So actually, we want to zoom in on this. This is reporting countries, areas, or territories. So there's about 19 being listed here, and of that 19, it looks like the positivity rate would come out to about 7.48% at this time. Okay, and there's probably not very many cases now, 27,000 cases. Yeah, that's not a lot of cases, but just something interesting I thought I would share with you. All right, moving on now to this. This is really interesting. Clearly, the New York City Health Department, or NYC Healthy, knows what's going on with long COVID. They know about it, and they're trying to raise awareness about it. Long COVID symptoms can last for weeks, months, or even years. These symptoms can be mild or severe, or they don't say this, something in between. I would say I'm probably in between mild and something in between. I'm definitely not severe. But learn more about how to manage long COVID and how you can support someone living with long COVID. So let's just take a look at this. Symptoms of long COVID. Always feeling very tired or feeling extremely tired after doing small physical or mental activities. Yeah, I know that feeling. I don't want to say that's from doing small things, but it feels to me, in my particular case, say I do a day where, I don't know, I work a lot more than usual and I do a lot. It takes me multiple days to recover from that sometimes. It does. This afternoon I plan to work quite a bit. Of course, you're watching this video in the afternoon. It's being released later than when I'm recording it. But yeah, I do feel that happens sometimes. And then every once in a while there'll be a day where I just do a little bit and that's enough to make me tired. Or I will get a few days where, hey, I'm not tired for several days, but then randomly a day, everything happens. That's random. Memory changes, such as trouble finding the right words, misplacing things, or changes in the ability to remember things. Yeah, you see me get mixed up with my words here once in a while. It does happen. Coughing or feeling short of breath. That's my biggest symptom of long COVID is the coughing business, which started with case 1 in 2020 and then came back again after case 2. And now I was on an injection for it. And if you've been following along, that injection's temporarily pause until insurance issues get figured out. Moving on to this. Sleep issues such as staying asleep or insomnia, trouble thinking clearly or concentrating, brain fog once in a rare while, constipation, diarrhea, or other GI symptoms, dizziness or fast heart rate. That is one thing I don't deal with is the fast heart rate. Issues with taste or smells, mood changes such as anxiety or depression, and headaches. Yes, I can raise my head to headaches. They're not as bad as they were a few months ago. They still happen on occasions. And as for anxiety or depression, I don't know. Maybe sometimes I do get where it's just like, oh, okay, this day is just overwhelming. Yeah, maybe that type thing. But I don't think it's a major issue for me. All right, moving on to this. And by the way, there's 150 to 200 different symptoms of long COVID. Yeah, so there's other things we don't even mention there. All right. Take a look at this. This is New Zealand. This is interesting. Some are saying, why are we following measles? Because measles was once contained. And with measles once being contained, everything was fine. Is this outbreak of measles that we're seeing around the world deadly? No. There have been a couple deaths here or there. Not many. There's been a few people hospitalized here or there. It's just more so the fact that measles is back and it's spreading again. And we, like to keep a track of it. So, look at this. Over in New Zealand, hundreds of ferry passengers potentially exposed to measles. This is a problem. This could lead to more cases, and there actually have been more cases now in New Zealand, and the number's now up to 6. It's nowhere near the size of outbreaks of other countries, but again, it sounds like 2 more cases have been reported at this time. Here in the United States, U.S. measles cases now top 1,600 cases. As South Carolina outbreak has grown, we mentioned that yesterday about South Carolina, but yes, the United States is now at 1,618 confirmed cases, and I still believe, with just a little over 2 months left, I believe 2,000 cases could definitely happen, and if it doesn't, well, missed cases would take us to 2,000. So you get the point here. Yeah, measles is still a problem, and this is the most cases since 1992. When the CDC reported 2,237 measles cases. Do I think it's in reach that we could top that? I don't think so, but who knows? At any given time, something could pop up and a new outbreak could happen real quick. So stay tuned. We'll continue to follow the measles situation. And speaking of that, Hawaii is now seeing a positive wastewater sample for measles. Yes, measles is showing up in Hawaii, in Kauai County, and this is the first time that has happened there this year. So, this is not a good thing, and we'll have to see if a positive case does show up. Could it be someone who traveled there? Could it be a tourist, or could it be someone who lives there and currently has measles? Hopefully, they go to see their doctor and we get a test result from them. All right, in the Netherlands, they are going to call 161,000 animals after bird flu is detected, and it sounds like this is going to be chickens on a poultry farm. I've been warning of this. Bird flu activities picking up again, and I think by the time we get into 2026, we may see egg prices start to rise in many different places, because here we go. Once again, we are dealing with problems, and I get it. Some countries, I think the United States included, is exporting some eggs, bringing eggs in from other countries or doing various different things, or importing, exporting, all that business. What happens if those areas start having a shortage because of bird flu? Yeah, it's possible where the domino effect could happen when it comes to bird flu. All right, let's see if we have anything yet from the UK. I'm going to refresh this page. The influenza page was not working correctly a little bit ago. Is it working correctly now? Well, here's what we got. We have up to October 19th, so this looks like it did update. 7% positivity rate. And take a look at this. Things were really taking off early. They were going up quick. And look what happened here. the positivity rate slowed down. But I'm seeing something very concerning here. Ages 5 to 14 years old. That is really catching my eyes. Net green. Wow. Ages 5 to 14 years, school age children. That positivity rate is really going up. Can we actually make this bigger than another screen? No, we can't. But the point is, you see here, yeah, that age group is really going up. Ages 15 to 14 years old, that dropped. All the other age groups either slowed a little bit or are still rising. And that drop from ages 15 to 14 years old, that's likely why we've seen the overall slowing down. All right, taking a look at COVID, if we can. This may not have updated yet. It is saying October 15th. Yeah, this updated. All right, some good news here, at least with cases. I'm seeing green. Down by 661 cases. We thought the UK was peaking last week. 2,618 new cases. But, when cases peak, deaths don't. Deaths go up for another couple weeks. And in this case, yeah, they went up. 141 new deaths reported. That's up by 41 or 41%. Another week or two, hopefully that will start to come back down. So they are seeing deaths from this latest wave. Healthcare did go up slightly. If that is up to date, I don't think it is. And the positivity rate for COVID, let's see what that is in the UK. Currently, it is down to 10.27%. It is significantly starting to drop, but again, at the same time, they are dealing with elevated flu levels. While flu levels, I'll show it to you again, they did slow off. They didn't necessarily drop. They did still go up slightly, and I think that rise will continue once again. Hey, RSV, what's going on with that? Yeah, RSV, the positivity rate is 1.32%. That is still rising slightly at this time. All right, let's take a look at what's going on with air qualities in the United States. We'll take a hydration break during that as well. Water is the drink of choice today. Oh my, bad air qualities in the West Coast. Yeah, the West and the Pacific Northwest wildfire season is extending itself. It's still ongoing. It can last into November, so I hear. And even southern British Columbia and Alberta, maybe some problems for you. Please be careful if you're in that area. The plains, just a few minor issues, and the rest of the country is pretty much doing okay at this time. Let's take a look at Pinellas County, Florida, where we do see, wow, sick person showing up many times. 1, 2, 3, 4, 5, 6, 7. Yeah, flu and RSV and other respiratory viruses, maybe rhinovirus. Those viruses are coming out to play now, and that could be a reason for that. And I think once we get post-Halloween, it's really going to start to go up. Hopefully, wastewater scan will help us show that. Who knows when we'll have CDC data again, if ever. We may not get CDC data once the government reopens. And I'm telling you, the government in the United States is probably not going to reopen until some point in November. I don't even think the House is in session right now. It is so ridiculous that they don't want to reopen us, that they don't want to do anything about health care. Some do, but then there's a whole other party saying, oh, we're not backing your health care until you change your mind on that. We're not going to even come in. It's so ridiculous. It gets me so annoyed and fed up because there are millions of people that are about to pay way more. I'm possibly one of them. I don't know what's going to happen. I'll find out on November 1st. Daily totals for Wednesday, October 22nd. This is Philadelphia. And we do want to take a look at the EMS incidents like we do every day. 714 reported. Live looking at Montgomery County. Wow, wow, wow. Up to 21 incidents right now. How many cardiac emergencies are there? 1, 2, 3, 4, 5, 6, at least 7 of them. Cardiac arrest is showing up a couple times. This is not good whatsoever. There's just way too many EMS calls in Montgomery County the past couple days. Chester County, wow, cardiac arrest is showing up there as well, and just a whole bunch of other things. A lot of calls right now. Bucks County, this, I refreshed this a little earlier, was at 13 calls. Let's see what the update is now. Hopefully, it's still at 13 calls. So, yeah, respiratory distress is showing up many times. I have to think, some of these viruses are coming, flu and different things. And plus, as you know, many people who have had COVID now have breathing problems. The doctor's office I was at yesterday, the entire month of November, they are completely booked for pulmonary function test at that office. Yeah, so breathing problems are real. Respiratory viruses are real. People who've had COVID and now have the common cold, they can deal with breathing problems because, weakens the immune system. There's a lot of different problems out there. Let's see. Anything out of New York yet? No, New York State did not update. We'll get another New York either tomorrow or on Saturday. I still want to do a Out in the Wild update at some point this week. I just don't know when that's going to be. Thought it would have been today, but we got too many things to look at here today. All right, moving on to a place we have not looked at in a while in terms of their dashboard, and that is Colorado. Now, I wish we could take a look at the variants, and I looked on here. I didn't see anything for variant data. Maybe it does exist, and I'm just not finding it, but sorry, it's not showing up here. COVID-19 emergency department visits are down at this time. Influenza is down, very low. RSV is low. The positivity rate there, and I don't even know honestly, when did this positivity rate actually update? Is it really 11.86% in Colorado at this time? It's saying it's up by 6.78%. I honestly don't know if that is actually correct at this time, although we can take a look at this chart over here. Now, it says overall virus activity is very low in Colorado, so we'll have to go with that. And yeah, I'm not seeing anything that would support this 11.86% positivity rate. I don't know, maybe when we read CJS data, there'll be something. Not likely, though. All right, let's just briefly take a look. We're just going to do one wastewater site somewhere because we got to get to that CJS data. And you know what? We're going to go somewhere where they're dealing with flu. And that is Lawrence, Kansas, where flu levels are medium at this time. Take a look at that. They went up really quickly in September. Then they did drop some. So interesting to see that. And everything else there, for the most part, is fine at this time. Alrighty, some data now from CJS. Here we go, and this is his midweek update. I just copied and pasted the whole thing here to this virus update notes because there are some things here that we need to take notes of. He said time for his midweek update of COVID counts, and because the CDC reporting has been effectively shut down, a bonus for this week's midweek update will be included in the midweek updates until federal reporting can resume. Some of these numbers that would have been posted last week. So there's different places here that you're going to hear. Starting off with last week's counts. Florida, October 11th through the 17th, 1,879 cases, 67 state reported deaths. New York, from October 11th through the 17th, 2,689 cases. And deaths that normally would have been reported last week weren't updated until yesterday. And Puerto Rico, 571 cases and 3 deaths. Also did not see those deaths from New York. Maybe he didn't post them. Arizona, 708 new cases. California, 2,779 new positive tests and 45 new state reported deaths. And then he did include some counties there as well. We're just going to name a couple here. LA, 11 new reported deaths. San Diego, look at this. 101 hospitalizations and 3 locally reported deaths. And Orange County, 3 new locally reported deaths. Santa Clara, 6 deaths. And let's see here. Louisiana, 513 emergency department visits, a test case positivity rate of 2.6%, and 3 new reported deaths. Hey, good to see Louisiana down. Still 513 emergency department visits. That's a lot. Massachusetts, weekly numbers. They had 658 new cases and 5 new state reported deaths. Michigan, 149 hospitalizations. Minnesota, 424 new cases and 8 new state reported deaths. New Jersey, 453 new cases and 5 new state reported deaths. New Mexico, 326 new cases. Let's highlight New Mexico and scroll down a little bit. North Carolina, 333 hospital visits for COVID-like illness. Ohio, 164 state-reported hospitalizations last week. There'll be a new number that comes in today. We'll have that number for you hopefully tomorrow if their state dashboard does update on time. Oklahoma had 252 new positive tests last week. West Virginia, 174. Wisconsin, 328, and a test case positivity rate of 3.8%. Now moving on to this week. Monday, Florida had 132 new cases and 1 new state reported death. New York, 320 new cases. Puerto Rico, 101 new cases and 3 new state reported deaths. Texas, 1,101 new cases. Now Tuesday numbers. Florida, 192 new cases and 2 new state reported deaths. New York, 195 new cases and doesn't look like there are any deaths reported there. Maine, 158 new cases. Virginia, 867 new positive tests. Now, I'm going to zoom this out so we can see the rest of this on the bottom. I thought we'd, whoa, that's too far. Okay, we will get this on there. Wednesday, Florida, 299 new cases and 6 new state reported deaths. New York, 837 new cases, likely includes cases not reported yesterday as the dashboard didn't update the day before. And 19 new state reported death. That's usually been updated on Fridays. And let's see, we got to zoom this in. But was updated yesterday. Washington had 597 emergency department visits for COVID-like illness and 2 new state reported deaths. Note, he did not include the case counts for Puerto Rico for either Tuesday or Wednesday because fewer than 100 cases were reported each of those 2 days. All right, thank you, CJS, for your updates and your data here. This is fantastic that you continue to do this. That is all that I have for today. I will have another update again tomorrow. Will it be out in the wild, or will that be on Saturday? I don't know. You'll have to find out. Quick hint, it will include the coughing meter, and that meter I think I'm going to be raising. It's not a scientific meter. It's just, from what I see, personally, a level of coughing. Out of all the people, I see or interact with, how many do I see coughing that I come up with a result? Alrighty, I will see you again tomorrow. Until I see you again tomorrow, stay safe, subscribe if you're new down below, hit the thumbs up, hit that notification bell, share this video with anyone you know, leave your comments down below. I will get to these comments. I will update, I will get up to date on all the comments, and if you want to support the channel, ways to do that, such as Patreon, are listed down below. Alrighty, have a fantastic Thursday afternoon, and thanks for watching.